The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. AOR's MetSyn 568R, also known as red yeast rice in Canada, promotes healthy cardiovascular function and supports healthy cholesterol levels without the undesirable effects of monocolin K. Monocolin K is a compound that is associated with side effects such as myopathy, muscle pain, and weakness. Unlike many other red yeast rice supplements on the market, AOR's red yeast rice is also made with a patented extraction process that removes citrulline, a toxic byproduct of the fermentation process. Learn more at your local retailers or online at aor.ca or aor.us. Thank you for tuning in to Supplementing Health. Heart disease is the leading cause of death in the United States and the second leading cause of death in Canada. Today we have Dr. Olivia Greenspan here to discuss the unique risks for women when it comes to heart health. Dr. Greenspan is a naturopathic doctor and cardiac nurse who, after working in the cardiac critical care and caring for the sickest of the sick, made it her mission to remove heart disease as the top killer of women. She does this through education and advocacy for a new heart health care paradigm. Welcome, Olivia.
Thank you for having me, Cassie.
So women and men can both experience cardiovascular disease, but they experience it differently. What are some of those warning signs for cardiovascular health that get overlooked in women?
To start with, I always like to talk to my patients about women's specific conditions that place women at a unique risk over men. I'll go through a few of those really important ones, Cassie, if you'd like me to. The number one thing I find women are unaware of is conditions in pregnancy. And of course, as men, they don't get pregnant, unfortunately, and women do. But some of the conditions that can show up in pregnancy, such as hypertension, gestational diabetes, preeclampsia, can put women at a significant risk after delivery. And a lot of women feel that when their levels normalize, their blood pressure normalizes, blood sugar normalizes, that they're sort of out of the woods. And it doesn't mean that you're doomed if you have these situations arise in pregnancy, but the risk is still there. So screening is really important for these women, and especially when it comes to preeclampsia, we have a lot of data on that. It does put women at a twofold increased risk to have a heart attack later on in life. So that's a really important one. I think the postpartum period is a really important time to educate women about these risks. The other thing is menopause and the changing of hormones during that time. And estrogen, we know, is very protective to the cardiovascular system. It helps regulate blood pressure. It acts as an antioxidant. It affects salt sensitivity. And so as that estrogen declines later in life, we see that those women have a significant risk that matches men when it comes to the risk of heart disease or having a heart attack. So a lot of women don't really concern themselves too much until menopause when it comes to heart health, and really that education and those preventative things that we can do, lifestyle things. I mean, there's so many things that we can do, needs to start much earlier than menopause. The other thing is PCOS, so polycystic ovarian syndrome, with women can put them at risk as well because of blood sugar issues. Insulin resistance, we know, plays a role in cardiovascular disease and endothelial dysfunction. So that's a really important one. And for women, there's autoimmune conditions that affect women disproportionately more than men as well, such as lupus, for example, and that chronic long-term exposure to inflammation, we know, again, puts women at risk for cardiovascular disease. So anybody with an autoimmune condition should also have, a heart health plan in place and should be having these conversations with their healthcare provider on how they can further protect their heart going forward. So those are the few big differences in terms of specific conditions that affect women more than men.
And are there differences in the symptoms that women experience then compared to their male counterparts?
Yeah. So when it comes to, having a heart attack, women can experience it differently than men. I mean, the most common sign is, chest pain, chest pressure, but that isn't always the case. And I know you see in the movies this dramatization of this crushing chest pain and elephant sitting on our chest. And sometimes that's not the case. And it confuses not just women, but men as well about when to seek treatment. And for women, they will often feel not just chest pain or discomfort, but they might feel this extreme fatigue. And I know that, a lot of women today running around and homeschooling children, taking care of older parents, they feel a lot of fatigue. But this is an unusual fatigue that sort of comes on out of the blue. And they might experience more fatigue with daily activities than they did before. So that's definitely a warning sign because the heart function, it's just not efficient and pumping as well if it's not getting enough blood flow. They might experience sleep problems that are sort of come on out of the blue preceding a heart attack or heart event. They might have more indigestion, lower chest pain, upper abdominal discomfort in that area they might feel. I had a patient recently that she didn't go to the emerge right away. She was experiencing this left arm ache. It wasn't terrible. It wasn't a pain, but it was like this just annoying left arm ache. And lo and behold, she did suffer a heart attack. She did recover and do well. But just as an example, I see that often in my work as a nurse where patients are like, they didn't have that chest pain, right? They had those sort of mild symptoms. And of course, women don't want to bother. They don't want to go to emerge and, complain about something that is so seems so trivial. But I always encourage people, if anything happens out of the abnormal, then you're better off safe than sorry and seeking help right away. And that's one of the reasons why it's more difficult to identify heart disease in women or heart attacks in women, and they often go missed because they have these sort of atypical signs. And we also have that sort of gender bias that heart disease happens more in men than women. So it leads to, a lot of disadvantages for women in terms of proper diagnosis, treatments, referrals, and so on.
And so what are some of the lab tests that you use in your practice as part of diagnosis and determining a treatment protocol?
I use a lot of just the basic labs that patients will get done through their family doctors. So the basic lipid panel, we can get a lot of information from that. It doesn't necessarily give us the whole story all the time, but I will do that. Or, if they've already had it done, we'll look at a lipid panel, fasting blood sugars, hemoglobin A1C, but also fasting insulin levels, because we do know that insulin resistance puts people at risk and can often show up years before diabetes will, or any significant changes on a hemoglobin A1C. Looking at inflammatory markers such as hsCRP. So again, chronic inflammation, we know that it's not necessarily diagnostic, but it does identify if there's inflammation there. Homocysteine is another one that I'll look at. and also lipoprotein particle testing. Of course, it depends, on the patient and what's going on, but especially if there's, significant risk factors, family history, and so on. That's another test that's it's more comprehensive. It covers a lot of ground in terms of identifying where we can sort of optimize treatment plans for patients. So those are probably the big ones that I tend to use with my patients. I mean, there's other testing as well, like oxidized LDL and fatty acid testing, and those are things that we might discuss as well in terms of the benefits and other information it might show us if it's going to change our treatment plan. Because sometimes doing labs doesn't change our treatment plan, and it can get expensive for patients, and it can be a slippery slope when we start doing all this testing. So there's always a conversation with patients that I'll have before we jump into just doing this whole battery of tests.
And speaking of the lipoprotein particles, I've heard lipoprotein A testing can be very beneficial. Can you speak to why that marker may contribute, or how that marker contributes to heart disease?
Yeah, so elevated lipoprotein A, it can significantly put patients at risk for having a heart attack or having stroke, and it might explain why half of the people that have a heart attack actually have normal cholesterol levels. So doing a lipid panel, their LDL might be completely optimized and with medication, but yet they'll still have a heart attack. And so the missing link may be this lipoprotein A. Unfortunately, in Ontario right now, as naturopaths, it's not a test that we can order. But the exciting thing is on the 2021 guidelines for dyslipidemia, it's actually includes lipoprotein A as a recommended test for patients at least once in their lifetime. So it's genetically influenced, the lipoprotein A, and unfortunately there isn't a ton that I've come across in the literature that actually significantly reduces this number. Statins don't impact it because it's not created in the liver the same pathway as LDL is. So statins don't really lower lipoprotein A, unfortunately. So if someone does have it tested and it is high, really, we're just focusing on maximizing all the other things we have control over that can make a big impact in people's health. So it is important to know. It's actually more common. I think it's 1 in 4 people actually have an elevated lipoprotein A. So I think it's a little bit more common than we think. And if we're testing it more routinely, we might see that more. But again, just honing in on the lifestyle pieces and optimizing all those risk factors for patients is the key thing. There is some information or some data out there that shows vegan diets may lower it about 10%, but that's always a tricky one for patients to do. But just maximizing all the controllable factors that we can would be my approach for patients.
So how frequently do you suggest women get screened, and at what age should they start getting screened?
Yeah, that's a good question. And to be honest, I don't really have any hard and fast rule about, specific ages. It really depends on the patient and what their whole risk profile looks like. I mean, there's some things, I think, the general Canadian guidelines, for testing is to start testing, for example, I think it's a lipid panel, start testing that, when a patient, when men and women are 40 or over 40. And I mean, I wouldn't wait that long. Definitely if they have significant family history, other risk factors, things like PCOS, we might want to check those parameters early on. Someone who is 20, if they have, significant history in their family of elevated cholesterol levels, we might want to check that in their 20s. For sure, when patients are thinking about, pregnancy and conception, doing all those things so we can optimize that before pregnancy, so we can optimize their pregnancy, the postpartum period, so they don't have these challenges in pregnancy, like, gestational diabetes and so on. and also ethnicity plays a role. So, African Canadian women are at significant risk for cardiovascular disease, Asian women, First Nations. So, you might want to check those women a lot earlier to optimize their risk. So I don't think there's any hard and fast rule. It's really patient specific. But I think the earlier, the better, for sure.
And so with the rise of wearable technology, people are getting more information about their heart rate variability, maybe their SpO2 levels, all these different metrics, and doing heart math. So what does this information provide for how your heart health is progressing?
Well, in terms of heart rate variability, I think it's a really great tool. It's fairly easy to measure and gives people real-time feedback in terms of their stress response, their autonomic health, the health of their autonomic nervous system. So we have two arms, the sympathetic, parasympathetic, and we don't want to be in that overdrive, fight and flight, sympathetic mode all the time. We need to have a balance, and heart rate variability can give us that real-time feedback. So heart rate variability in a nutshell is the beat-to-beat variation in your heartbeat. So just because your heartbeat is 60 beats per minute, it doesn't mean that every second it's beating. There might be, milliseconds in between there where there's a variation. And people who have good heart rate variability, that will give us information about their autonomic nervous system. So they're going to be in less of a stressed state or have more resilience in terms of the stress response. And people who have, poor diets, who are not sleeping well, not handling stress. I mean, we can't avoid it, but we can manage it better. Not exercising. That can all impact our heart rate variability and lower our variability in our heart rate. So it's a measure of sort of our resilience, our overall cardiovascular health. There's even indicates our immune health as well. People with diabetes tend to have lower heart rate variability. So it's a nice little tool, and you can shift your heart rate variability really quickly with just doing simple techniques like just breathing. And when you're breathing, focusing on more positive sort of heartfelt emotions like love or gratitude, thinking of someone that you care about, and focusing on that can actually change our heart rate variability within minutes. And I've seen that a little bit in my practice with patients. If they come in really stressed and we put a device on that can measure that heart rate variability and we get them to breathe, we can see that nice shift in the nervous system in what's in sort of working overtime during that session. So, it's nothing fancy. It's really simple. And it just goes to show you, like, just breathing and focusing on our breath can make a huge impact in our physiology in a moment.
So then a higher heart rate variability is better because then you'd be in a more calm and relaxed state, correct?
Yeah, exactly. And you can sort of even feel that, like, when you're taking breaths, when you're breathing in and out, you can feel that sort of variation in your heart rate going up and going down. So that can give us an indicator. I mean, the best one is, on an actual ECG strip, looking at the variability from beat to beat. But high heart rate variability is better and shows better, cardiovascular health than a lower heart rate variability.
And is there a number range that people should be aiming for if they are using wearable technology so that they have an idea of where they should be? I think it
really depends on the device that's being used and sort of baseline as well. So getting a baseline and tracking that, can show whether you're improving or whether you're staying the same or whether you're getting worse. That's how I tend to do it with my patients.
Okay, cool. So you'd mentioned a little bit about how family history plays a role in heart disease. How important is it if you have a history of cardiovascular disease in your family to get the details of what it was and how that impacts you?
Well, it's very important, family history, but it's not, it's one risk factor, but it's not the risk factor. But we know that if you do have cardiovascular disease in the family or heart attack in someone before the age of 65, in women are 55 and men, that it can sort of double your risk for heart disease compared to someone who doesn't have a significant family history. But we can actually, those who are at a genetically high risk for cardiovascular disease, we can actually significantly reduce that risk in half by basic, optimizing all those parameters we talked about, the lifestyle, getting that extra support. We can definitely reduce risk. So it does play a really important role, especially when there is significant genetic heart conditions. I mean, when we talk about cardiovascular disease, we're not just talking about ischemic heart disease where there's plaque buildup in the arteries, but other heart diseases like arrhythmias. And there are some arrhythmias that are genetically linked, run in families, and that's really important information to know. So there's different cardiomyopathies that predispose patients to arrhythmias, deadly arrhythmias, and people need to know that information. It's really, really important for people so they can get proper follow-up, and if they need any, further cardiovascular care, that it's done timely. So it is definitely important, but just like anything, it's one risk factor out of many.
And one of the lifestyle factors that we hear about time and time again is, of course, exercise or movement. So do you have specific types of exercise plans that are better for women with heart conditions, or perhaps exercises that women with heart conditions should be avoiding?
I really don't. When it comes to exercise, I'm not going to recommend a whole bunch of, these exercise plans to people if they just don't enjoy it, because then they're not going to do it and it's really hard to stick to. And I always recommend, if people do have heart conditions, they need to be seen by a cardiologist, and they need to be cleared, and they need to have that education about what they can and can't do. So I don't have specific recommendations, but we know that the exercise is extremely beneficial to the cardiovascular system, and not just the cardiovascular system, but our whole body. It's an antidepressant. It helps our mood. It helps reduce inflammation. It helps with body weight for older women. It's really important to maintain muscle mass, so we don't lose muscle or have sarcopenia as we age. It helps with our cholesterol levels. It helps with inflammation, balance, bone health. It improves it improves the mitochondrial health, their efficiency, and the number of mitochondria. So just getting people to move, and recommending just walking is the easiest thing for people to do. It's the most accessible. Throw on some running shoes and get outside. And some little hacks, throw in walking poles, increasing your stride. Doing hilly paths is going to increase your aerobic fitness. And for some people, doing high intensity interval training, if they like it, is also beneficial, especially people that don't have a lot of time, and getting more of that vigorous activity in is really important, not just, so moderate to vigorous. You want a combination of both. Yeah.
Okay, no, that all makes sense. And then the other large part of the lifestyle piece is nutrition, of course. So do you have like your top 5 heart healthy foods that you think women should be incorporating into their diets?
That's a really tough one to narrow it to 5. There's so many beneficial foods that are great for cardiovascular health. But some of the key ones that I do recommend for people are, berries. So, blackberries, blueberries, those deep purple pigments are really great for the cardiovascular system. They have a lot of antioxidants. They're lower in sugar, so that's always great because we want to eat more of that low glycemic load diet to balance our blood sugars. Greens, beetroots, they're great. They have nitrates in them, which help with healthy blood pressure. So they help produce nitric oxide in the body and help keep our blood pressure nice and healthy. The healthy fats, so avocados, which are great. It's a great healthy fat. Fiber, it has glutathione in it, magnesium, our olives, olive oil, the polyphenols. Nuts are great to help support endothelial function. Of course, your fatty fish. Specifically with women, some soy is, long as it's not GMO, it's organic. The polyphenols are great in soy as well to help with the cardiovascular system. And if with menopausal symptoms, we know that soy products can help. And fiber. So your ground chia, your ground flax. We have to remember that when we're thinking about the cardiovascular system, the gut has a tremendous impact on the cardiovascular system as well. And so we want to keep our microbiome nice and healthy because that can affect blood sugar. It can affect inflammation. So keeping a nice, healthy microbiome is really, really important. And there's some interesting research about the health of the microbiome and healing after having a cardiac event, because it does modulate our immune response, and it can affect how the heart heals after a heart attack, and can affect the remodeling of a heart after a heart attack. So there's some interesting research about that, and using time-restricted feeding as a tool to help heal after a heart attack. So it's not robust, but it's definitely coming to light, and it's really, really interesting, and it falls along the category of circadian medicine and how we have this body clock and how things shift. So just some interesting little tidbit there. I sort of geeked out there for a second. But
is it possible to reverse the damage that has been done to the heart after a cardiac event?
To a certain extent, I think it is. But and that's, just the normal processes. You can have damage and the heart does heal from it, but it really depends on the extent of damage too. If someone has, smaller heart attack where, not as much of the heart muscle was damaged, how long they waited before they got treatment, all those factors play a role. And then, like I said, all these other factors, managing the inflammatory cascade, managing the circadian rhythm. So sleep after a heart attack is really, really important as well, because that's going to impact inflammation. So some of it can be reversed, and sometimes it can't. It sort of depends on the whole situation and timing of everything.
And if you had to pick like one or two most important things that you would wish every woman knew about assessing their heart disease risk, what would those be?
I would say for sure understanding the impact on your pregnancy history. I think that's really important. I feel like I come across that a lot in my practice, that patients didn't realize that these things impacted their health later on in life. So understanding that impact and just intervening as early as possible and making your heart health a priority is super important. I think that's sort of one of the key things, and knowing your unique risks. So not just the pregnancy piece, but those other items we talked about before that affect women. So menopause, autoimmunity, PCOS, the role of hormones. I think that's really, really important, and having those conversations with your physician about what you can do before it's too late. I think that's really important. And then just the impact of just those basic lifestyle pieces. Exercise, I think, is just critically important. We need to move on a regular basis, and we need to make time, and it doesn't have to be complicated. Just getting out for 10 minutes, break it up during the day. I think that's really important. I feel like the patients that I see in the hospital that do the best are the ones that, maintain a really active lifestyle, even though they may have had a heart attack, because there's so much we don't know about cardiovascular disease. The ones that kept a very healthy lifestyle, did exercise on a regular basis. They're always active. Do the best, I think, for sure. So those would be some key pieces that women need to be aware of for sure. Yeah.
Awesome. Well, thank you so much for taking the time to share your insights and chat with me today. If our listeners would like to get a hold of you, work with you, or learn more from you, how would they go about doing that?
So they can check out my website, oliviagreenspan.ca. And, I am on Instagram, I am on Facebook, but the best way to get a hold of me would just go to my website, and all the information is there.
Fantastic. Well, thank you again. And thank you to the listeners who tuned in for today's episode of Supplementing Health. Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic, or email us at marketing@aor.ca.